Hi, I'm Tom Tresh. I'm a physical therapist at Corewell Health, and I'm going to be showing you how to use NMES to address quadriceps weakness after knee surgery. Neuromuscular electric stimulation, or NMES, to the quadriceps muscles is a useful rehabilitation intervention after a variety of orthopedic knee surgeries, most commonly ACL reconstruction. It is well regarded, having received an A grade in the 2017 Knee Stability and Movement Coordination Impairments Clinical Practice Guideline. However, its effect is determined by the details of how it is used, and recent attention has been called to variations between the evidence-based fundamentals of NMES and its typical implementation in physical therapy clinics. Prior to applying NMES, explain the procedure to your patient. Ensure agreement, understanding, and consent prior to performing, as it will likely be uncomfortable. It is best if your patient is wearing shorts, so the electrodes are easy to place. Using 3x5 inch pads is best for both patient comfort and ensuring full quadriceps activation. Cleaning the skin with soap and water can also help with comfort, as it will improve skin conductivity. Avoid alcohol pads because excessive drying would be counterproductive. Place the pads over the quadriceps motor points, commonly understood to be midline or slightly medial of midline, over the muscle belly of the distal vastus medialis, and slightly lateral of midline on the muscle belly of the proximal vastus lateralis. Connect the pads and turn on the machine. A good option is symmetric biphasic current, 50 to 75 pulses per second, at a 400 microsecond pulse width or greater, with a 2-second ramp up and down. Most NMES units will allow you to save a custom protocol with these parameters to access easily in future sessions. NMES targets peripheral deconditioning of the quadriceps. This is partially a consequence of arthrogenic muscle inhibition, or AMI, which has central nervous system mechanisms that are currently being researched for potential intervention. With NMES, current thought is that you are not reducing the inhibition from AMI, but circumventing it in order to achieve a strengthening stimulus despite inhibition. Just as with typical exercise for strength, intensity is an important factor. To dose intensity with NMES properly, the quadriceps should be stimulated to produce greater than 50% of its maximum voluntary isometric contraction, known as MVIC. To measure MVIC, a handheld dynamometer can be used in the same position that the NMES will be applied. Positioning the patient at 70 to 90 degrees of knee flexion is ideal, with a block at the ankle to prevent extension of the knee during contraction. Notably, no ACL graft strain occurs with quadriceps contraction in this position. Set the dynamometer to measure peak force over 5 seconds. Cue the patient to push as hard as they possibly can. In the early weeks after surgery, while the quadriceps force output is low, you will likely be able to stabilize the dynamometer adequately for an accurate measurement. But be aware that if you are unable to provide a stable counterforce, especially as quadriceps strength increases, fixation methods outside the scope of this video may be required for an accurate measurement. Once you have obtained the MVIC measurement, the goal will be to produce at least 50% of that force with NMES, with even higher being better. We recommend programming your NMES unit to 15 minutes duration, 10 seconds on, and 20 seconds off. During the first 5 minutes, the frequent contractions will allow you to increase the current progressively. When the patient is ready, increase the current until the patient feels tingling, then continue to increase steadily until movement of the quadriceps is noted. At this point, continue to increase, but at a slower pace until the patient's tolerance is reached. Increase the current several milliamps every contraction. You can have your patient do this themselves so that they can increase according to their improving tolerance. Your goal is to reach the greater than 50% MVIC target in 5 minutes. Several periodic rechecks with the dynamometer will ensure that you have reached the target. At this point, change the frequency to 10 seconds on, 50 seconds off, which will minimize muscle fatigue. 10 full intensity contractions will then be delivered in the 10 remaining minutes. As your patient becomes comfortable with this intervention, they should be able to complete the 10 full intensity contractions independently, allowing you to move your attention elsewhere. They should be instructed to continue to increase the current as tolerated. Note that this is meant to be a passive NMES. The patient is not attempting to push on their own. Including NMES in your treatment for the first 6 to 8 weeks after surgery is recommended. Weekly frequency of NMES sessions is less established in the literature. As it is a strengthening intervention, 2 to 3 times per week will likely have an effect as long as the intensity and volume, or number of repetitions, produces adequate quadriceps fatigue. The patient can supplement their in-clinic NMES sessions with use of a home unit, but 2 considerations should be remembered. First, as with all strength exercises, excessive frequency or volume can be counterproductive if recovery is inadequate. This will require your judgment as it can vary from patient to patient and week to week. Second, as we have discussed, intensity of the NMES is an important factor, and your encouragement, support, and feedback with the dynamometer in the clinic may be key to achieving adequate intensity. If you have any questions about this, reach out to me via email, thomas.tresh@corewellhealth.org.